Understanding the holistic concept in TCM. Today, we explore the interconnection of body systems and their relation to the environment in TCM practice. TCM perceives the human body as an interconnected system where every part functions in harmony with the whole. This perspective highlights the inseparable relationship between the body and nature, reflecting the belief that health and vitality stem from this unity. TCM perceives the human body as an organic whole, where every part is interconnected and influences the others. This perspective emphasizes the inseparability of body structures and functions. Organs within the body are not only anatomically connected, but also have physiological relationships that influence one another's functions. This interdependence highlights the holistic approach of TCM in health and disease. The holistic concept in TCM encompasses two critical aspects: the human body as an integrated system and the intrinsic unity between the human body and the surrounding natural environment, emphasizing balance and harmony with nature. In TCM, the human body is viewed as an interconnected organic whole, where the five Zhang organs serve as the core. All body components, including the six Fu organs, five tissues, and five sense organs, are connected through meridians, working together to facilitate essential functions through essence, qi, blood, and body fluid. Core components of the Zhang Fu organs. Five Zhang organs are central, six Fu organs function, five tissues are interconnected, organs support each other, meridians connect organs. In TCM, meridians serve as interconnected pathways that facilitate communication and coordination among the body's organs and systems. These channels ensure that essence, qi, blood, and body fluid circulate effectively, maintaining harmony and balance within the body. Essence is the foundational substance in TCM, essential for growth, development, and reproductive functions. It is derived from both prenatal and postnatal sources and plays a critical role in sustaining life. Qi is recognized as the vital life force that flows throughout the body, enabling all physiological activities. It is responsible for maintaining health, vitality, and balance within the body systems. Blood, considered a precious substance in TCM, nourishes the organs and tissues, ensuring they receive the nutrients needed for optimal function. It also plays a key role in emotional well-being and vitality. Body fluid encompasses various fluids in the body, including sweat and lymph. It is crucial for maintaining hydration, regulating temperature, and supporting metabolic processes. Adequate body fluid balance is essential for overall health. TCM emphasizes the intricate relationship between the human body and nature, highlighting how seasonal, daily, and geographical changes influence physiological functions. The body's adaptability to these changes showcases its dynamic nature, maintaining a balance of yin and yang to ensure optimal health and well-being. During spring and summer, warmer temperatures lead to the dispersal of yang qi. This dispersal causes skin to relax and pores to open, promoting sweating as a natural process for the body to clear excess heat. This physiological response helps maintain the balance of yin and yang within the body. In autumn and winter, the body experiences cooler temperatures, which lead to the storage of yang qi. As a result, the skin tightens, pores close, and there is a reduction in sweating. Instead, the body often produces more urine to regulate hydration and maintain normal water metabolism, showcasing the adaptability to seasonal changes. During the day, the body's yang qi circulates externally, which enhances the functional activities of the Zhang Fu organs, thereby promoting overall health and vitality. In the morning, yang qi begins to rise, preparing the body for activity and alertness, aligning with the natural rhythm of the day. At noon, yang qi reaches its peak, resulting in maximum energy and vitality, which supports the body's highest level of functional activity. As night falls, yang qi is retained within the body, facilitating rest and recovery. This internalization supports the body's natural healing processes during sleep. Climatic differences significantly impact the physiological processes of the body. Variations in temperature, humidity, and altitude can alter metabolic functions, immune responses, and overall health. For instance, individuals in colder climates may experience changes in circulation and skin moisture compared to those in warmer regions. Adaptation to new environments requires time as the body must acclimatize to the different climatic conditions. This process involves physiological adjustments such as changes in sweat production, respiratory rates, and energy expenditure. Although initially challenging, the body can successfully adapt to new climates with patience and care. The holistic concept of TCM emphasizes the inseparable relationship between the human body and nature, illustrating that physiological processes are deeply influenced by seasonal, daily, and geographical changes.
Discussing exploring the relationship between the five senses, nine orifices, and internal organs. A comprehensive analysis of how our sensory perceptions intertwine with bodily functions as described in ancient texts. The five senses are intricately linked to the nine orifices, which play a crucial role in human physiology. Each sense corresponds to specific internal organs, establishing a network of communication that impacts our perception and overall health. Overview of internal organs and their functions. The heart is vital for circulating blood throughout the body and plays a crucial role in regulating emotions and mental well-being. The liver is essential for detoxifying harmful substances, breaking down fats, and metabolizing nutrients to provide energy. The spleen plays a role in digestion, converting food into energy and supporting the immune system by producing blood cells. The lungs facilitate respiration, allowing oxygen intake and carbon dioxide expulsion, while also playing a role in the immune response. The kidneys filter blood to remove waste, balance fluids, and regulate electrolytes, playing a critical role in maintaining overall health. The nine orifices explained: two eyes, two nostrils, two ears, mouth, urethra, and anus. Communication between yin organs and orifices. Understanding the connections between internal organs and the senses helps us grasp the holistic nature of health. Lung qi and the nose. When lung qi is harmonious, it enables the nose to effectively detect and discern smells. The liver qi and the eyes. When liver qi is balanced, it allows the eyes to distinguish colors clearly. Spleen qi and the mouth. When spleen qi is in harmony, it enhances the ability of the mouth to taste food. Heart qi and the tongue. When heart qi is well regulated, the tongue can identify the five distinct flavors. Kidney qi and the ears. When kidney qi is balanced, it facilitates the ears in hearing a variety of sounds. harmony of lung qi, and the sense of smell. The nose, as one of the nine orifices, it directly influences by lung qi when lung qi is balanced. The nose functions optimally allow for the effective detection and discrimination of odors, which is essential for taste and environmental awareness. The role of liver qi in vision and color distinction. Liver qi governs the eyes, enabling them to perceive color accurately. When liver qi is balanced, it facilitates the differentiation of shades, supporting overall visual clarity and health. The role of spleen qi in taste perception. Spleen qi is essential for the overall sense of taste, allowing us to enjoy and discern flavors. When the spleen qi is balanced, it supports the proper functioning of the mouth, leading to an enhanced ability to taste food and appreciate its varied flavors. Heart qi, the key to understanding the five flavors. The tongue plays a vital role in tasting and distinguishing the five primary flavors: sweet, sour, bitter, pungent, and salty. When heart qi is balanced, the ability to perceive these flavors is enhanced, indicating overall health and vitality. Kidney qi and ears, the role of hearing. The ears, as one of the nine orifices, are essential for the sense of hearing, which is influenced by kidney qi. When kidney qi is harmonious, it enhances auditory perception, allowing us to hear sounds clearly and distinctly, including the five essential sounds that contribute to our understanding of the environment. The sense of touch and its unique role. While traditional frameworks recognize five primary senses, the sense of touch is often excluded from the alignment with the nine orifices and five internal organs. This exclusion highlights a unique perspective on how the body's sensory and organ systems interact, emphasizing the specific roles of the senses related to the internal organs. Health implications of organs on the senses. The relationship between the five senses and internal organs is intricate, as each organ corresponds to specific senses and orifices. For instance, the eyes are linked to the liver, affecting our ability to distinguish colors, while the nose is linked to the lungs, influencing our sense of smell. This connection illustrates how imbalances in the organs can lead to a sensory dysfunction. When the five yin organs are out of balance, it affects the seven orifices, leading to various health issues. For example, when lung qi is deficient, it may result in skin problems, which signify an imbalance in the lungs. Similarly, disturbances in the spleen can manifest as lung issues, correlating to the mouth's function. The sense of taste is linked to both the spleen, which governs general taste perception, and the heart, which helps distinguish specific flavors. If these organs are not functioning properly, it can lead to altered taste sensitivity or loss of taste. The relationship between the internal organs and the nine orifices emphasizes the harmony among the five organs is essential for optimal functioning of the senses. Disruptions in this balance can lead to a variety of health issues, highlighting the importance of maintaining both physical and energetic well-being.
Understanding the small intestine channel of Han Tai Yang. an in-depth exploration of the small intestine channels, pathways, connections, and clinical significance in traditional Chinese medicine. The small intestine channel of Han Tai Yang is essential in TCM, governing the connection between organs and the flow of qi. It initiates at SI1 on the little finger and traverses the arm and shoulder, linking to significant organs such as the heart and stomach, thus influencing digestion and bodily functions. Anatomy of the small intestine primary channel. The SI channel, primary channel, begins at the ulnar corner of the little finger at point SI1, which is associated with the heart primary channel at point heart 9. This establishes the hand yin-yang connection. From SI1, the channel ascends along the ulnar aspect of the hand to SI6, reaching the wrist where it emerges at the styloid process of the ulna. At SI8, the channel passes between the olecranon and the medial epicondyle of the humerus, essential for elbow movement. The channel continues to SI10, running along the posterior aspect of the upper arm, vital for shoulder and arm mobility. The small intestine primary channel zigzags across the scapula, connecting with the extraordinary vessel at various points, integrating the shoulder and back regions. External pathway of the small intestine channel, a comprehensive overview of the external pathway tracing the journey of the SI primary channel. The channel begins at SI1, located at the ulnar corner of the little finger, separating from the heart primary channel at heart 9. The channel ascends along the ulnar border of the hand, passes the wrist, and continues to the medial aspects of the elbow, specifically between the olecranon and medial epicondyle. The pathway ascends the posterior aspect of the humerus to reach the shoulder joint where it connects with LI14. The channel zigzags across the scapula, passing through points such as bladder 41 and bladder 11. The pathway connects with 214 below the spinous process of C7, integrating with other yang primary channels. Internal pathway and connections. Understanding the internal pathway of the small intestine channel reveals its significant connections with various organs, highlighting its role in digestion and qi flow. Begins at the supraclavicular fossa, establishing the connection with the heart. Travels downward to connect with the heart, the paired Zhang organ. Continues to RAN 17, intersecting the conception vessel. Penetrates the diaphragm, descending through the esophagus. Connects with the stomach, crossing RAN 13 and RAN 12. Finally, spreads within its associated fu organ, the small intestine. Clinical importance of the small intestine channel. The small intestine channel plays a crucial role in TCM for diagnosing and treating a variety of conditions. It is particularly significant in addressing issues related to digestion, such as pain and distension in the upper abdomen, as well as connections with the heart and stomach organs, affecting overall health and well-being. Exterior signs and symptoms: mouth and tongue ulcers, cheek pain, neck pain, occipital stiffness, pain on the lateral aspect of the shoulder and upper arm. Interior signs and symptoms: pain and distension in abdomen, radiating pain to genitals, diarrhea symptoms manifestation, epigastric pain with constipation. Connections with other channels. The small intestine channel connects with the heart primary channel, establishing a key hand yin-yang connection at SI1. This relationship is essential for the flow of qi and maintaining balance within the body, linking emotional health with digestive functions. Additionally, the SI channel has a connection with the bladder primary channel at SI18, following the six-channel theory. This pairing enhances the dynamic relationship between the hand and foot channels, emphasizing the interconnectedness of bodily systems. Connections with other Zhang Fu organ systems. The SI channel is closely linked to the heart, facilitating the flow of qi between these two organs, which is essential for overall health and emotional balance. The SI interacts with the stomach, playing a crucial role in digestion and the transformation of food into qi and blood. As a paired organ, the SI works synergistically with itself to manage the separation of pure and impure substances within the body, essential for maintaining health and vitality. History of Chinese tongue diagnosis, Yuan Dynasty. Today we explore the evolution and significance of tongue diagnosis in TCM during the Yuan Dynasty. Tongue diagnosis is a crucial diagnostic tool in TCM, providing insights into a patient's health through the examination of tongue appearance. This practice has deep historical roots, with the Yuan Dynasty marking a significant evolution as it became a distinct specialty in medical studies, laying the groundwork for future advancements in the field. Development of tongue diagnosis in the Yuan Dynasty. Here we have a timeline highlighting key milestones in the evolution of tongue diagnosis as a specialized field. 1279 to 1368, the Yuan Dynasty marks the establishment of tongue diagnosis as a distinct specialty in medical studies, leading to foundational texts in the practice. Early 1300s, A.O. authored Record of the Golden Mirrors, the first book focused solely on tongue diagnosis, addressing cold-induced disorders with 12 illustrations. In 1341, Du Qingpi published a revised edition of Ao's work, adding 24 illustrations and enhancing the clinical insights related to tongue diagnosis. Written during the Yuan Dynasty, Ao's Record of the Golden Mirrors marks a significant advancement in tongue diagnosis, primarily addressing cold-induced disorders. This seminal work laid the groundwork for future studies, featuring 12 illustrative examples that depict various tongue conditions related to Zhang Zhongqing's teachings. Importance of Ao's work in medical literature. Ao's Record of the Golden Mirrors established a framework for future studies in tongue diagnosis, becoming the cornerstone of the field and influencing subsequent medical texts and practices in traditional Chinese medicine. The book introduced critical concepts of tongue diagnosis, including body colors, surface alterations, and coating colors, providing a systematic way to interpret tongue features in clinical practice. Ao's work highlighted the relationship between tongue diagnosis and cold-induced disorders, drawing connections to the theories of Zhang Zhongqing, which enriched the diagnostic framework for practitioners. Du Qingpi played a crucial role in advancing tongue diagnosis by recognizing the importance of Ao's original text. He enhanced this foundational work by revising it, adding new illustrations, and providing comprehensive clinical insights, thereby solidifying its relevance in TCM. Revisions and enhancements in Du Qingpi's edition. Du Qingpi recognized the value of Ao's original work and took the initiative to improve it, ensuring its relevance and usability for practitioners. In addition to the original illustrations, Du Qingpi enhanced the volume by adding 24 new illustrations, providing a more comprehensive visual reference for practitioners. The revised edition was published in 1341, titled Ao's Record of the Golden Mirror of Cold-Induced Disorders, solidifying its place as a critical resource in tongue diagnosis. Key tongue body colors and their meanings. Understanding tongue colors is essential for diagnosing underlying health conditions. Pale indicates deficiency. Red suggests heat or excess. Blue reflects cold or stagnation. Alterations in tongue surface, types and implications. Red prickles indicate heat. Cracks suggest deficiency. Deviated shape reflects pathology. Coating colors and their significance. A white coating on the tongue often indicates cold conditions within the body, suggesting deficiency in yang energy or a presence of cold pathogens affecting the digestive system. A yellow coating on the tongue is typically associated with heat conditions, indicating excess yang energy or the presence of heat pathogens often linked to digestive issues or infections. Gray or black coatings on the tongue suggest more severe pathological conditions, often indicating a very serious internal imbalance that may require immediate medical attention. Tongue shapes, differentiation, and diagnosis. Swollen indicates dampness, flabby suggests deficiency, prickly reflects heat, deviated suggests underlying issues, curved indicates liver qi stagnation. Clinical manual, analysis of tongue conditions. Understanding tongue diagnosis through a structured analysis framework is essential for effective treatment. Deficiency versus excess identifies whether the condition is due to lack of vital substances or an overabundance, guiding treatment approaches. Hot versus cold influences differentiates conditions based on thermal nature, essential for recognizing appropriate treatment methods. Pathology insights analyzes underlying causes linked to tongue patterns, supporting accurate diagnosis. Herbal treatment recommendations suggest herbal remedies tailored to diagnose conditions based on tongue analysis. Clinical prognosis evaluates disease severity and expected outcomes, aiding in comprehensive patient management. Pathology and herbal treatment in tongue diagnosis. Pathology in tongue diagnosis focuses on understanding the underlying causes of various tongue conditions. This includes examining body color, surface alterations, and shapes to deduce the patient's health status. Each tongue condition reflects specific internal imbalances, such as deficiencies or excesses of heat or cold. Herbal treatment involves prescribing remedies that align with the diagnosed conditions of the tongue. Based on the analysis of the tongue features, practitioners recommend specific herbs and formulas that target the identified health issues and restore balance within the body. The Yuan dynasty marked a significant turning point in the specialization of tongue diagnosis within Chinese medicine. Notable works like Ao's and Tu Qingbi's records not only enriched medical literature, but also established foundational principles for assessing health through tongue examination, influencing practices for generations to come. Introduction to Pulse Diagnosis. An accessible introduction to the art and practice of pulse diagnosis in traditional Chinese medicine. Pulse diagnosis is a diagnostic tool used in acupuncture that combines precision with an element of mystery. While it may be perceived as complex and esoteric, it is actually accessible and indispensable for practitioners, offering vital insights even to novices with minimal practice. The importance of pulse diagnosis in acupuncture. Pulse diagnosis offers critical insights that can be grasped quickly by those new to acupuncture. Even beginners can start to interpret pulse qualities with just a small amount of practice, making it an accessible tool for diagnostic assessment. Understanding the pulse enables practitioners to gather immediate insights into a patient's health and physiological status. This knowledge allows for a more tailored treatment approach and enhances overall patient care. Pulse diagnosis is crucial for assessing various conditions that may present simultaneously in patients. It simplifies and refines the diagnostic process, helping practitioners quickly identify and address imbalances. Common misconceptions about pulse diagnosis. Overly complex learning process only for trained experts requires years of training. Understanding the basics, 28 pulse descriptions and 12 positions. Pulse diagnosis includes 28 pulse descriptions and 12 positions, allowing practitioners to identify specific conditions and gain vital insights into the patient's health. And there are 6 key characteristics that are perceived easily. Pulse diagnosis, often viewed as esoteric, is actually accessible to all practitioners. With just a little practice, even novices can quickly learn to assess essential pulse characteristics, leading to valuable diagnostic insights. Key characteristics of the pulse. The pulse can indicate whether a patient has a weak or replete condition, providing crucial information about their overall Qi levels and vitality. Pulse rate, whether fast or slow, can signify underlying conditions such as heat or cold, aiding practitioners in quickly identifying imbalances. The depth of the pulse, deep or superficial, provides insights into the nature of a condition, helping to differentiate between interior and exterior patterns. Applying the six pulse characteristics to the eight principles. Understanding the relationship between pulse characteristics and diagnostic principles is crucial for accurate assessment of patient health. Weak or replete identifies whether there is a deficiency, Shu, or excess Shi condition. Fast or slow indicates the presence of heat, fast pulse, or cold, slow pulse within the body. Deep or superficial helps determine if the condition is of interior or exterior origin. Differentiating symptoms enables practitioners to categorize complex symptoms into manageable diagnostic principles. Comprehensive diagnosis supports a holistic view of the patient's health by correlating pulse features with eight principles. Improved treatment plans facilitates targeted treatment strategies based on clear diagnostic insights. Real-life applications, case study of fatigue and shortness of breath. Understanding pulse diagnosis through practical examples enhances diagnostic accuracy and patient care. Initial consultation, patient presents with symptoms of fatigue and shortness of breath, prompting an initial pulse diagnosis assessment. A weak pulse is detected during examination, indicating a Shu condition and guiding further diagnosis. Further assessment of the pulse reveals whether the condition pertains to lung Qi deficiency or kidney Qi deficiency, aiding in targeted treatment planning. The unique strengths of pulse diagnosis. Pulse diagnosis stands out as a powerful diagnostic tool that can be used independently to assess a patient's condition, unlike other methods that often require corroborative symptoms or extensive questioning. Pulse diagnosis allows practitioners to gather immediate insights directly from the pulse. This immediacy can be crucial in situations where time is of the essence or when the patient presents with complex conflicting symptoms. Other diagnostic methods, such as tongue diagnosis and HARA, abdominal diagnosis, do not possess the same level of independence as pulse diagnosis. While they can provide valuable information, they often need to be used in conjunction with additional signs or questions to ensure accuracy. This reliance on supplementary data can complicate the diagnostic process and lengthen the time required to reach a conclusion. Comparing pulse diagnosis with other diagnostic methods, pulse provides immediate insights. Pulse can diagnose independently. Tongue diagnosis needs visual aid. HARA requires symptom correlation. Pulse integrates multiple insights. The learning process. Practice makes perfect. An effective approach to mastering pulse diagnosis through structured learning and repeated practice. Understanding the basic aspects of pulse diagnosis and the significance of the 28 pulse descriptions and 12 positions. Engaging in practical sessions to apply knowledge and gain confidence in pulse taking. Regularly feeling pulses to develop sensitivity and skill in identifying key characteristics. Studying and memorizing diagnostic interpretations related to the pulse qualities. Attaining a higher level of skill through dedicated practice and experience. Combining pulse diagnosis with other diagnostic methods for a holistic understanding. Pulse diagnosis is a precise and valuable tool in acupuncture that, while initially perceived as complex, can be learned and applied effectively by practitioners of all levels. With consistent practice and thorough understanding, pulse diagnosis allows for insightful assessments of patient imbalances, enhancing diagnostic accuracy and treatment outcomes. Mood point theory in scalp acupuncture. Today, we explore the significance of mood point theory in relation to scalp acupuncture and its impact on organ energy and treatment efficacy. Mood point theory integrates the energies of Zangfo organs, represented by 12 specific points located in the chest and abdomen. This theory is essential for understanding how these points influence health and their application in scalp acupuncture treatments. Mood points are integral to the Zangfo organ system, reflecting the energetic connection between these organs and their corresponding anatomical locations. The 12 mood points serve as key acupuncture points that correspond to major organs, facilitating targeted treatment in acupuncture practices. Most mood points are located on the Rand meridian, which adds to their effectiveness in treating organ-related disorders, despite not lying directly on their respective meridians. The Zangfo organs play a vital role in the body's overall function and health. Each organ corresponds to a specific mood point located at the chest and abdomen, making it essential for diagnosis and treatment in acupuncture. Mood points, while mainly situated on the Rand meridian, allow for targeted treatment of various organ-related issues. The connection between these points and their corresponding organ facilitates the effective therapeutic interventions in acupuncture practice. Mood points serve as vital junctions where the energies of the Zangfo organs converge, specifically situated in the chest and abdominal areas. This strategic positioning not only facilitates accessibility of acupuncture treatment, but also enhances the efficacy of addressing related organ health issues. Case study: stomach mood point, Rand 12. Rand 12 is a critical mood point located on the Rand meridian, directly correlating with the stomach area. Its strategic location allows for effective treatment of various stomach disorders, showcasing significance of mood point theory in acupuncture practice. Scalp acupuncture targets specific regions on the scalp that correlate with different body functions and organs. This technique is particularly beneficial for treating neurological conditions by enhancing the brain signaling to the body, facilitating recovery in cases such as paralysis or motor control issues. Linking mood point theory to scalp acupuncture. Mood points serve as crucial energy centers for the Zangfo organs, and scalp acupuncture directly stimulates the brain areas corresponding to these points, enhancing therapeutic outcomes. Scalp acupuncture has shown effectiveness in treating paralysis by targeting specific motor control areas in the brain, which correspond to relevant mood points, thereby improving functionality in affected limbs. The integration of mood point theory within scalp acupuncture illustrates a blend of ancient wisdom and contemporary practices, enhancing the efficacy of treatments for various conditions. Case study: treating paralysis with scalp acupuncture. Scalp acupuncture leverages mood point theory to effectively address paralysis by targeting specific brain areas that correspond to motor control. By stimulating these areas, practitioners can influence the neurological pathways associated with the extremities, promoting recovery and enhancing motor function in patients with brain damage. Mood point theory underscores integration of traditional acupuncture concepts with modern treatment approaches. By highlighting the interaction between mood points, Zangfo organs, and scalp acupuncture, practitioners can devise more effective strategies for addressing various health conditions, including neurological issues. Anatomy of the auricle, the frontal surface. Today, we explore the detailed structures and features of the auricle's frontal surface anatomy. The auricle, also known as the pinna, is a crucial component of the ear that plays a significant role in capturing and directing sound waves into the auditory canal. Its unique structure and contours enhance sound localization and aid in the overall auditory experience, making it an essential part of the auditory system. Overview of the auricle structure. The helix is the curling brim of the auricle, contributing to its distinctive shape and functionality in sound collection. The antihelix is an elevated ridge that runs parallel to the helix, adding complexity to the auricle structure and aiding in sound wave direction. The tragus is a curved flap that connects the auricle to the face, playing a role in sound localization and protection of the ear canal. The earlobe is the soft and fleshy part of the auricle, lacking cartilage, and contributes to the overall shape and aesthetic of the ear. The helix is the prominent curling brim of the auricle that aids in capturing sound waves. It features distinct areas such as the helix tubercle, helix crus, and helix root, which contribute to its overall structure and auditory function. The helix tubercle is a prominent anatomical feature of the auricle, situated at the posterior superior aspect of the helix. This small bulge serves as a distinctive landmark, aiding in the identification and understanding of auricular anatomy. The helix crus is a transverse ridge of the helix that extends backward into the ear cavity. This structure plays a crucial role in the overall architecture of the auricle, guiding sound waves toward the inner structures of the ear. The helix root serves as the pivotal junction connecting the helix and the tragus, playing a vital role in the overall structure of the auricle. This area is essential for maintaining the integrity and function of the auricle, as it helps shape the ear's outer contour and contributes to sound localization. The helix cauda represents the inferior section of the helix, seamlessly connecting it to the soft tissue of the earlobe. This junction is significant as it contributes to the overall contour of the auricle and aids in sound wave collection. The antihelix is an elevated ridge that runs anterior and parallel to the helix, forming an essential part of auricle anatomy. It features a Y-shaped configuration with the superior antihelix crus extending vertically and the inferior antihelix crus extending horizontally. The triangular fossa is a distinct anatomical feature of the auricle, defined by its triangular shape and flanked by the superior and inferior antihelix crus. This fossa plays a role in the overall structure and function of the ear, contributing to sound localization and resonance. The scaphoid fossa is a significant anatomical feature of the auricle, acting as a narrow longitudinal curve depression. It is situated between the helix and the antihelix, playing a role in the overall shape and function of the ear. The tragus is a small curved flap of cartilage located anterior to the auricle, serving as a protective barrier for the ear canal. Its position and shape play a vital role in sound direction and collection, contributing to the overall auditory function. The supratragic notch is a notable depression located above the tragus, between its upper border and the helix crus. This anatomical feature plays a role in the overall contour of the auricle and can affect sound direction and perception. The antitragus is a small tubercle situated directly opposite the tragus, positioned above the earlobe. It plays a role in the overall structure of the auricle and contributes to the sound localization by affecting the way sound waves enter the ear canal. The intertragus notch is a U-shaped curve located between the tragus and the antitragus, playing a role in the structure of the ear. This anatomical feature aids in sound localization and contributes to the overall shape of the auricle. The antihelix notch is a shallow indentation located between the antitragus and the antihelix. This anatomical feature plays a role in the overall structure and contour of the auricle, contributing to its unique shape and sound localization abilities. The earlobe is the lowest part of the auricle, characterized by its soft and fleshy tissue. Unlike other parts of the auricle, it does not contain cartilage, making it more flexible and pliable. The superior concha is a depression located in the auricle, situated above the helix screws. It plays a significant role in directing sound waves towards the auditory canal. The inferior concha is found below the helix screws in the auricle. This depression also contributes to the collection and direction of sound waves toward the auditory meatus. The auditory meatus serves as the passageway through which sound waves enter the ear canal, leading to the tympanic membrane. It is situated within the inferior concha area, playing a critical role in the auditory system by channeling sound to the inner ear. The concha wall serves as the vertical surface that connects the floor of the concha to the antihelix ridge. This structure plays a role in shaping the ear's anatomy and contributes to sound wave collection and direction. The internal helix, which refers to the concealed underside of the helix, that plays a role in the overall structure of the auricle. Its anatomical significance lies in its contribution to the shape and function of the ear as it supports the framework of the auricle. The superior auricle serves as a critical connection point between the auricle and the scalp, facilitating structural support and positioning of the ear on the head. The inferior auricle connects the earlobe to the cheek, playing a role in the overall structure and function of the auricle in relation to the face. The auricle is a complex structure composed of various components that contribute to its function in sound collection and direction finding. Key features include the helix, antihelix, tragus, and concha, each playing a distinct role in the overall anatomy and functionality of the ear.
Let's discuss gua sha for lower limb ache. Exploring gua sha techniques to elevate lower limb discomfort and promote circulation. In today's fast-paced world, many individuals opt for convenient modes of transportation like buses and cars, leading to a sedentary lifestyle and a lack of physical activity. This lifestyle change results in many experiencing soreness, pain, and weakness in the lower limbs, particularly among middle-aged and older adults who are also dealing with age-related factors that exacerbate these symptoms. Causes of lower limb discomfort. Many individuals today lead a sedentary lifestyle, preferring buses or cars over walking. This lack of physical activity contributes significantly to feelings of soreness and weakness in the lower limbs. As people age, bodily functions can weaken, making middle-aged and older adults more susceptible to pain and discomfort in their lower limbs. Insufficient circulation of vital energy in blood can lead to pain and heaviness in the lower limbs, often exacerbated by a sedentary lifestyle and aging. Varicose veins can cause significant discomfort and pain in the lower limbs, often making scraping therapies unsuitable for those with serious symptoms. The impact of sedentary lifestyle. A sedentary lifestyle characterized by prolonged periods of sitting or inactivity results in decreased blood circulation and muscle weakness in the lower limbs. This can cause discomfort, soreness, and pain, particularly in individuals who frequently use vehicles instead of walking or engaging in physical activity. Age-related factors in lower limb pain. With age, muscle strength and endurance naturally decline, which can lead to increased soreness and weakness in the lower limbs, affecting mobility and quality of life. Older adults are more prone to developing varicose veins due to weakened vein walls and valves, leading to increased discomfort and pain in the lower limbs. Aging can lead to a decrease in blood circulation efficiency, which can exacerbate pain and discomfort in the lower limbs, making them feel heavy and sore. Elderly individuals often experience greater sensitivity to pain and discomfort, making them more vulnerable to lower limb issues that can significantly impact daily activities. Understanding gua therapy. Gua is a TCM therapy used to enhance blood circulation and relieve pain by scraping the skin. It is especially effective for addressing discomfort in the lower limbs caused by factors such as a lack of exercise, weakened body functions, and blockers of vital energy and blood flow. Benefits of gua for lower limbs. Promotes effective blood circulation. It eases lower limb soreness, enhances fluid metabolism, and smooths meridians and energy flow. Precautions of varicose veins and gua sha. Varicose veins can exacerbate lower limb pain and discomfort. Scraping therapy is not advised for individuals with serious varicose veins as it may worsen the condition. For those with mild symptoms, it is essential to rest and minimize prolonged standing to prevent further strain. While after surgery, intervention for varicose veins, it is crucial to protect the operated area. Patients should avoid standing or sitting for extended periods to promote healing and prevent complications. Gentle movement is encouraged to aid recovery without exerting the legs. Recommended gua sha procedures. Effective scraping techniques to elevate lower limb comfort and promote healing. The Wei Chong, bladder 40, and the Chen Shan, bladder 57, uses surface scraping on the rear of the knee and shin, or pressing and kneading these acupoints 15 to 20 times. The Mingmen, GB4, and Shishi, bladder 52, scrape from the waist upwards until skin reddens or sha appears. The Huan Tiao, GB30, and the Dubi, stomach 35, press and knead GB30 with moderate force, followed by gentle pressure on stomach 35. The Shi Yang Quan, GB33, and the Yang Ling Quan, GB34, the Chu Quan, liver 8, and the Yin Ling Quan, spleen 9, scrape along the lateral and medial knee points for comprehensive relief.